how Transcarent begins to improve to simplify that experience, given all of the barriers.
Over 2 years ago, we made a bet, and that bet was on this thing called AI. And so in terms of AI, we made an investment now well over $100 million, which in the digital health space is bigger than most companies. And we made that investment based on the fact that we thought using a combination of very smart technology. And so today we found ourselves as literally the one and the only comprehensive AI-powered platform. And the focus is really three areas: creating an experience people love, delivering actual better care, and doing it at a lower cost than people spend today.
Welcome to the Analyzing Healthcare podcast, brought to you by Scale Community. Scale is a global healthcare-focused member network where healthcare leaders come to connect, learn, share ideas, and shape what's next in our evolving healthcare landscape. To take advantage of all that Scale Community has to offer, from expansive content to virtual and in-person events to interactive peer networking opportunities and more, check out Scale Community at www.scale-community.com. Membership options range from free to paid, so if you enjoyed today's discussion, please take a moment to sign up for your preferred membership level.
All right, welcome to the next Analyzing Healthcare by Scale Community podcast. I am very excited to be joined by Glen Tullman, the CEO of Transcarent. Glen, welcome to the podcast.
Well, thank you very much. It's great to be a part of it.
So I normally jump right into the company, but I wanted to take a minute to go cover your background. Going back 20, 30 years, there's one sort of hit after hit in the healthcare space. Enterprise systems, you led as CEO through a successful IPO and sale to McKesson. You then spent 15 years at Allscripts, again as CEO, taking the company through a successful IPO. You then went on to Livongo as founder and CEO of the company, and over 6 years brought the company through the largest digital health IPO, and ultimately a merger with Teladoc valuing Livongo at $18.5 billion. You have founded a venture capital fund that's made a number of exciting and successful investments. And what brings us to this conversation today, you founded and are the CEO of Transcarent. And so when I think about all that's going on in the healthcare market, innovation, new technologies, new entrants to the market, some successful, many will ultimately peter out over time, most likely. It's interesting that I see success after success after success on the topic of technology and innovation. And so the first question I want to begin with is, in that context of really spotting trends, spotting gaps, spotting areas for improvement and innovation, help us understand who Transcarent is and really what led you to start this company back in 2019, 2020.
Sure. Well, maybe I'll begin with the second half of that first, which is why start the company? And it's a very common question. A lot of people say, why in the world are you doing this again? Because when you start a company, you really have to start at the bottom level, and you got to work your way up. You got to earn the trust. You have to earn the respect of your clients again and again. And despite what you did in the past, none of that matters. It only matters where the clients and the investors who are investors in our current entity, Transcarent, about how we're doing. The history is great, but it's history. And people are interested in looking forward, as am I. So why did I start Transcarent? First and foremost, I love building companies. I love the process. I love the people element of it. Number one. Number two, I love solving problems, particularly big problems. And there is no bigger problem than healthcare today. It is, you can't build a great country, can't build a great company unless you have healthy people. And that's more important than anything else, I would argue. So big problem. And then last but not least, we learned a lot at Livongo, my last company. We learned that you could create in healthcare a great experience, that you could deliver higher quality care. And believe it or not, you could do it at a lower cost, not a higher cost. And no one had ever done those three things together, which is part of the reason why Livongo was valued so highly. And we did what today would be called AI. Back then, we were some of the first to do that with incredibly bright engineers and software developers and product people, because we could tell for someone with diabetes what was happening in their body actually before they even knew it. That was through predictive analytics and, again, things today we call AI. So we knew we could do it. When I left Livongo, I had a number of different inquiries, some from existing companies, but a lot of our former customers said, Glenn, can you do what you did at Livongo for the rest of healthcare? Because we still have the problem. You may have helped us solve it for people with diabetes and other chronic conditions like hypertension, but that was a small number, and we'd like you to go broader. And at the same time, I had outreach from a company called Haven. You might remember that was the joint venture between JP Morgan, Berkshire Hathaway, and Amazon. And they said, would you like to come and run this? We're in the process of a CEO transition. And I looked at it and I said, right idea, but the three partners didn't make sense. Each of them individually, a great company, each of them had very different objectives. So I said, I want to be in this business. I want to help business solve the healthcare challenge. That was a big challenge when I started this and is even bigger today. And that is people, if you survey them, whether they're Republican or Democrat, young or old, men or women, all ethnicities, first and foremost, they say healthcare is more confusing, it's more complex, it's more costly, and it's getting worse, not better. And they really don't like their healthcare. And so I knew we could create an experience that they would not just like, that they would love, that we could make quality better, and that we could do it at a lower cost. But we had to involve technology. So that was why I started Transcarent. And the idea of Transcarent really stemmed from me moving out to Silicon Valley. And I moved from Chicago. I'm still a Chicago resident, but the tax people would say I live in California. Who knows? When I arrived out in Silicon Valley, they said, we build platforms and applications that make it easier to travel, to bank, to do whatever you want to do. And in healthcare, the middle keeps getting bigger and bigger. And that's where the friction is. That's where the cost is. So why don't you build something that makes it easier to access high quality, affordable health and care? And that became our mission, making it easy for people to access high quality, affordable health and care. So that first word was, how do you make it super easy? And then you need access. That's 24/7. You have to always start with quality, because you're not going to say for your partners, for your parents, for your kids, I want the lowest quality place. You're going to start with, give me the highest quality people to address whatever the issue is. So access, high quality, and it has to be affordable. Doesn't help if I say, Jason, here's a great doctor. You can't afford him. You can't get in there, but he's great. And then focusing on health, keeping people healthy, and care. And so that's what we did. That was the mission. And the vision was all of your health and care in one place, right here on your phone. So whether it be, questions about your benefits, whether it be questions about what you should do. I hurt my shoulder. What should I do? Or whether it be, I want to talk to a doctor right now in 60 seconds. All of that had to be in one place. And you had to be able to talk to it in any language. That's what we built at Transcarent. So that's the vision and the mission, and that's a long answer to your question.
So that's great. I mean, it sounds like the connective tissue between Livongo and Transcarent is the core pillars that you mentioned, but really centered around experience to the end user, the patient. And so in one case, diabetes, chronic care. In the other case, just access to holistic healthcare, which is interesting because I always think of Transcarent as focused on the employer market, so B2B, but really it sounds like you built an offering that in its structure and its value prop is focused on the patient, more so than the enterprise. And then there are probably ancillary benefits to the business. But am I right in that? In hearing
Well,
your
I
answer?
think I would make you're generally right. I would just alter it in two ways. Distribution philosophy is go to employers because that's where the people are. It's kind of like when they asked Dillinger, why do you rob banks? He said, because that's where the money is. Well, if you want to sign up 1,000, 5,000, 10,000, 50,000 people at one time, go to an employer. That's where they are. Number two, employers pay for a lot of the healthcare. So they care about it. And if you're not paying, if your healthcare only costs $5 or $10 or $20, you're less concerned about what the real cost is. You're concerned about what your cost is. So we knew there was interest from employers. We knew that's where the people were from employers. So that was really important for us. The flip side, though, is I wouldn't say patients. We talk about people because you have to catch people before they get sick. So when we talk about not healthcare, but health and care, what we're really talking about is keeping people healthy and outside the four walls of the hospital. And then if they need care, getting them the best care. And that's really important because we know, for example, we do 30% too many surgeries in this country. So sometimes the best care I can give you is saying, Jason, you don't need surgery. You could get this done through physical therapy. And we have great tools today, like SOAR, like Hinge, that you could even do it at home. So that education process sometimes it's best not to deliver care or to deliver it in a different way.
I want to get one level deeper on Transcarent and what the offering is. But before I do that, I have one question back to your Allscripts days. So Livongo and Transcarent, I think it's very interesting, both on simplifying the experience, which yields better quality, which yields better cost, which yields better experience. But really, you looked at a situation and you said, this is a suboptimal experience, and I can simplify the equation using technology to connect the different parts that need to be connected to create a better experience. When I think about EMRs, I don't necessarily associate it with great experience, simplified great experience for a whole host of reasons, many of which have nothing to, aren't the fault of the EMR. Healthcare is complicated. I'm just curious if that principle that you've carried over from company to company of simplification and user experience, was it as prevalent in how you thought about building and crafting the EMR product, or are there limitations that prevented that from shining through as to the same extent?
No, it's a great observation. And remember that how Allscripts started wasn't as an EMR company. It started in electronic prescribing. And that was how simple could we make it for a doctor to write an electronic prescription, because they were scribbling on pads of paper and people were dying because of it. The Institute of Medicine reported back when we started the company, 6,000 Americans a year would die from preventable medication errors. Things like drug-to-drug interactions, drug-to-weight, drug-to-pregnancy, and on, and just plain bad handwriting. And we've all joked about it over the years, how bad physician handwriting is, but it was no joke. So how could we build a little electronic pad that looked back then a lot like our phones look now, touch screen, that made it incredibly easy, almost as easy as writing a script on a pad. Then, once we got that electronic device in people's hands, they said, can I dictate into that? So we had a dictation. Then they said, can I send a message to do billing off of this? The more and more we became this accidental, what was then called an electronic medical record. Mm-hmm. And then over time, we started to say, oh my gosh, we're getting utilization. Nobody else could. Then we started to focus, can we make it broader? Can we change it to an electronic health record? Remember who we were selling to as we made that transition into practice management and then into electronic health records. We were selling to 50,000 small physician groups. And the interesting thing about those groups is you're selling generally to the owners.
Right.
And if the owners don't like it, guess what? They don't pay you. So Allscripts, without question, had the most user-friendly EHR of any of them out on the market. When you transitioned from that market, and by the way, even today, the providers who are out there, they're generally pretty well received for small practices. When you moved into the hospital, it became not an electronic health record. The real name should have been an electronic billing record. Yeah. It became about billing, number one. And number two, the primary providers, Epic and Cerner, who are they selling to? Not the users. Sometimes the users didn't even see it. They were selling to boards of directors. They were selling these massive investments to the board, to the CEO, to the CTO. And they were talking about, we can improve your billing. We can improve your integration. They weren't talking about user experience. And to this day, the Epic user experience is terrible. And let's think about how bad it got. It was so bad that organizations, health systems were hiring scribes to actually do the entry into the Epic system because it was too hard for their doctors to use. Fast forward today, we have people who simply talk to their phone and say things like, my shoulder hurts, what should I do? And we provide them using AI a whole series of options. So we were always focused on number of keystrokes, how easy it was to use in all scripts. And we had an open platform that was very different from what the hospitals did. And today, when people think about electronic health records, they're always talking about the hospital systems. But the bulk of the use still is outside the hospital. And there's a number of different systems that are out there that are much more usable.
So really the same core principle carries through, and it speaks to progress is relative. You mentioned a starting point where people are on paper and handwritten prescriptions. So moving to digital, even if it's not perfect, still represents progress. And then two, it sounds like you did know your market that you were selling to and customize the experience to that market. So concepts that'll carry over back to Transcarent, and we can go a layer deeper. I mean, you talk about picking a complicated space. This feels like right at the top of the pyramid of complicated spaces. How do consumers, members consume healthcare, which is broad. There's preventative care, there's reactive care, there's the financing of care, there's the in-person care, there's the inpatient care, there's the remote care. And the starting point for this space is one, like the handwritten notes, you're spoiled for choice for how to improve. So give us a little bit more detail on how Transcarent begins to improve to simplify that experience. And given all of the barriers, in terms of interoperability of data, in terms of all the places that I would need to go as a patient to access care, how do you solve for that comprehensive experience when it seems so fragmented as a user, as a patient, as a member?
Well, I think that first and foremost, you do exactly what you were commenting on. You start with the experience because the reality is if people don't use it, nothing else matters. So you have to make it incredibly usable. And I'm reminded of a story. My son was playing a video game and I went in and I said, hey, I'd like to learn the game. Where are the directions? And he looked at me and he said, Dad, nothing smart has directions anymore. You just start doing it. And I went back to our developers, and this was in a prior business, and I said, hey guys, nothing smart has directions. You make it so easy that people can just start using it. And today, when you talk about Transcarent in our wayfinding AI product, especially version 2.0, literally you log on and you talk to it. And everybody knows how to talk. You don't have to use certain terms. You don't have to know certain keystrokes. You don't need a scribe to use it for you. It's like any other app. Nobody taught you. You didn't take a class to learn to use Google. And more than 1 billion people figured it out. And same with Amazon, and same with Uber, and same with on and on and on. So we wanted to build technology that was so easy that anybody could use it. And by the way, if you ask the same question multiple times, we give you an answer, but each time we step it down 2 grade levels. So we make it easier and easier. If you start to talk to the application in Spanish, it talks back in Spanish. So again, incredible ease of use. That was a key element of that. And in terms of the product itself, we were very fortunate and maybe a little smart. Over 2 years ago, we made a bet, and that bet was on this thing called AI. And so in terms of AI, we made an investment now well over $100 million, which in the digital health space is bigger than most companies. And we made that investment based on the fact that we thought using a combination of very smart technology with very good and responsive physicians and nurses and therapists and caregivers and very good connections to the rest of the ecosystem, we could create an experience that people up until now have only dreamed about. And so today we found ourselves as literally the one and the only comprehensive AI-powered platform that's focused on health and care. And the focus is really 3 areas: creating an experience people love, delivering actual better care, and number 3, doing it at a lower cost than people spend today. And all 3 of those are essentially non-existent. Now, there's people out there who will say, we're using AI too, and they probably are. They should be in some element. We're using AI to create the entire experience that says one place for all your health and care, all your benefits questions, all your questions about what should you do I hurt my shoulder. What should I do? And all your questions about connect me to care, whether that's care in 60 seconds, which we provide 24 hours a day, whether it's a telehealth appointment, either real time or scheduled, whether it's one of our partners, could be a health system. It could be, an on-site doctor for somebody like Apple. It could be a near-site doctor provided by, Premise or some of the other great companies that are out there doing that. We'll connect to anybody you want. And now this new release that we just talked about, it has scheduling. So not only do we say, here's 3 good doctors, if you pick one, tell us when you'd like to see him and we'll arrange an appointment. Now, we might get back to you and say, next Thursday afternoon is not available. He or she is not in the office, but they have Friday and Saturday and Monday. What time would you like? So it's all of a sudden we built in the agentive capability for the first time. And again, nobody else has done anything like that.
So if I'm an employee of a Coca-Cola, JP Morgan, Amazon, a large company, and that company uses Transcarent, how does my experience different from if Transcarent were not there? It sounds like I'm going to this portal, the solution to find my primary care doctor, my specialty care doctor, make appointments. It sounds like there's an element of telehealth. How is, practically day to day, what does that experience feel like, and how is it different from a scenario without Transcarent?
Essentially, what you do is you download our platform on your phone. And from then on, you look at your phone, you touch the icon, you look at your phone, it logs you on because it's facial ID. And then any question at all that you have could be about your benefits, could be what's my deductible? I forgot my insurance card. Anything you have, it answers instantly. At any time, you can touch a little icon and talk to a real person. We have those too. They're standing by. You can connect with a doctor. You can schedule an appointment. You can ask questions about your care. You could say, my partner and I are planning a family. What's the benefit here? And it would answer that. You could say, I need to go to an ER. Here's the closest ER. Here's the wait time. Here's the directions, or do you need an ambulance? Anything that you have, any healthcare questions are now answered. But here's the thing, they're personalized to you. So you could say, how much is left in my deductible? Now, even if you had a great HR person, you called them up on the phone, or one of the legacy navigators, nobody could answer that real time. They'd say, hold on, let me look it up. Let me go through this system. They'd probably say, can I get back to you? And now it's all available. It's all real time, no different than your bank balance. And, that's the kind of responsiveness that we think that everyone deserves in health and care.
When the platform is recommending a doctor or giving options of a doctor, is there a consideration of quality and cost in that? If so, how are you building the network of physicians that are recommended?
Absolutely. Well, first of all, there's a few things that we'll consider. Quality is always first, as I mentioned, and that's a number of different metrics and a number of different sources that we use. We don't decide. We're using a number of different outside metrics, number one. Number two, you want to know not only are they high quality, are they covered? So are they on my plan? That's really important. So we might say, here's the top 3 doctors, because it's your choice. And you can drill in and say, where'd they go to school? Did they go to a great school like you went to, University of Pennsylvania? Where'd they get their degree from? You could look at their records, their own quality ratings, including outside ratings on them. You could drill down on any doctor. What do they practice? Are they board certified? So you can go deep on quality just right on your phone. It's all there. And then you choose a doctor, but you'll know here's the ones on your plan, here's the ones off your plan, and here's what it would cost if you went there, because you want to know that. Affordability is really important. Quality first, but affordability as well. So, and then we'd say, okay, here's the doctor, you pick one. And then we'd say, would you like us to schedule an appointment with him or her? What are your preferred times? And the agentive capability just introduced, so everybody doesn't have it yet, but just introduced, it's real, it's live. It would go ahead and schedule it just like if you had an assistant. And the beauty is you don't have to pay for an assistant, and it works for everybody the exact same way.
It sounds like there are a couple parties in the relationship. So there's Transcarent, there's the employer, and then I would imagine there's the traditional insurer who's at a minimum playing the administrative role of overseeing the plan. Then there may be other players involved too. Question is, it sounds like your view is that this experiential layer is a skill set in and of itself that is not going to be tackled by the employer because this is not what they focus on day to day. but it's also not going to be tackled by the payer. And I'm curious why that experience layer is not tackled by the payer.
Well, I think first and foremost, you have a number of different parties that could potentially tackle that. And employers generally want an arm's length relationship with their employees. I don't want to know, God forbid, that you have cancer or something else, because then that ties my hands in terms of everything from ongoing employment and the like. So employers want some distance. They want their employees to have great care and the like. In terms of payers, traditionally, they've been saddled with older systems and not been the best at that front end employee experience. That's not been where they thrive. Now, there are some very innovative, great payers out there, Blue Shield, for example, in California. You've seen them in innovating in a variety of different ways. In the PBM space, they left the traditional PBMs and they created their own offering with people like, Amazon and others. And so they've been an innovator. We're working closely with Blue Shield and actually have a digital first plan, among other things. So there are payers that are innovating, but remember, no one has to invent everything themselves. For example, many of us use LLMs. We aren't going to build that ourselves. There's a number of good ones out there. They've invested billions. And so you want to look and say, what's your skill set? What are you best at? What do you want to contract for? What do you want to tie into your offering? In some cases, we're providing services to payers and it's completely white labeled. So they're just buying the engine from us and they are the front end. And that's great with us. We just want to get people better care. So, there are the traditional navigators who are out there. And if you've read my history, people said, I don't understand. You said the traditional navigators have no place healthcare. And then you went and spent $600 million and you bought one. And so the issue was we bought it because we knew our technology could transform the experience for their client base. And we've done that. But the traditional navigators who are still out there, the Quantums and the Included, they still say, hey, call us. And we have really nice people. And I'm sure they do. But none of us want to make a phone call. We just want the answer. We're not going to banks anymore and meeting with really nice tellers. And we aren't calling travel agents anymore to meet with really nice travel agents. We can do it ourselves. The software has gotten that good. And we don't call for a taxi anymore. We Uber or we Lyft. So that's been the step. And they just haven't had. Now they're trying to play catch up a little bit. But this is a whole separate skill set. You have to be in the right place. You have to have the right vision, number one. You have to be in the right places where there are the right quality of engineers. Silicon Valley, Seattle, both places where we have locations. That's where the bulk of this work is happening.
Yep.
And then you have to be willing to invest the money. It's not inexpensive, as I mentioned, over $100 million and growing just for us. And last but not least, you have to understand healthcare. And so that's why we're working across the spectrum in every area with people to put that mix together and get people better care and do it not in the future, because we hear all about, we're going to have this in AI, we're going to have that in AI. But the reality is the only ones who have it today and are delivering is Transcarent.
It sounds like you're pulling in market data on quality, on cost, and you're personalizing the experience. You mentioned, through language and through agentic AI to talk about a patient's particular needs. And then you're also bringing in their specific benefits, plans, and status. So deductible and things of that nature. Are you also looking into claims data or any type of clinical documentation in order to get personalized experience, or that's not part of the offering today?
Exactly. No, that's exactly. In fact, in our new release, we talked about 4 things. 1, advanced symptom checking, making sure we can identify by having a discussion with you, by listening to your words, exactly what your issue is. It's number 1. Number 2, scheduling. We just talked about that. Agentic scheduling for the first time to say, you tell me when you want to see the doctor, we'll set up the appointment. Number 3, something called total recall memory. And that is, I remember all your past conversations. And so if I told you last time your blood pressure was high, I'm going to ask you in this conversation, by the way, Jason, did you ever take care of that blood pressure? You want me to go ahead and schedule an appointment for that as well? Or, Jason, you're not picking up your meds. I can see that from the data. How can we make it easier? Can we use Amazon or Cost Plus from Mark Cuban to deliver it to your home? So we're going to be really smart about that using total recall memory. And then last but not least, something called personalized health path. And that's where we're doing what you just suggested. We're taking all the data you've given us, all the visits you've had, all of your claims history, and each month we're giving you a personalized health path. Not a plan, but a path, something you follow. And that might say, here's 3 things to do if you want to live longer based on who you are, a man, your age, with your background, etc. And then here's 3 clinical things you really got to pay attention to. It might say, above this age, you need a colonoscopy or a mammogram. It might say you need a shingles vaccine. That's what's recommended. It might say if you have chronic conditions, you should get a flu vaccine in particular, because we know that population is particularly valuable. And so based on everything we know about you, it is absolutely going to customize something. It might say you've been to the ER 3 times in the last month. Can we schedule a follow-up with a physician to talk with you? That can't be good for you, and it's surely not good for your company and their bottom line. That gives us a wide berth to take care of you because nobody wants to go to the ER, and it's hugely expensive. So imagine if the company, now we could go back to the company and say, this person's cost you $15,000 in the last month. Let us get them a personalized health trainer or therapist or whatever they need. Companies always say yes. 1, they want to take care of their people, and 2, they want to keep the costs down. But if you didn't have that kind of technology, you could never identify that.
Well, and this big amorphous topic of improving healthcare, I mean, I think it does boil down to the 3 topics. So one is delivering care at a lower cost and navigating, making sure that people get to the right cost of care environment and, high quality, low cost. And it sounds like on that, you're playing a critical role in simplifying that process of getting patients aware of and to the right location from a cost quality perspective. Number 2 is bringing transparency to the financial situation from the patient's perspective. And it sounds like you're significantly helping in that too. How much is my deductible? You could imagine taking it even a step further, maybe helping with eligibility verification on a particular procedure, but you're clearly helping in that second pillar as well. And then the third pillar is integrating the care delivery experience across what's a highly fragmented experience for many of us. I go to my primary care and they're at a hospital system. I go to my cardiologist and they're standalone in a different system or maybe not part of a system. And so it's very fragmented. We've seen different theories about what's going to sort of disrupt that fragmentation. Maybe the payers are going to create their own value-based care navigation framework. Maybe there are going to be navigation companies that will solve for this. Maybe EMRs will solve for this. The Epic Community program that allows, for more integrated EMR experience and less data silos for those that are within that, or the qualified information health networks that are trying to break down data silos, beyond a given EMR. And then there's Transcarent, which is coming in at the experience level and its own vantage point. Which of those players is most likely to succeed in creating an integrated care delivery experience? Because I've always kind of looked at, data interoperability, EMR records as the key, but maybe it's more in the Transcarent camp to come in and specialize in experience as you've done when it comes to these other areas and think about how do I apply this last piece to the pillar of the care delivery ecosystem.
Well, I do think it's transparent, but I think there's going to be in the future, everyone's going to have to be like Transcarent. And that is creating a great experience up front, number 1. Number 2, using technology like AI to help informate that experience. And number 3, doing it at a much lower cost. Each of those represent challenges. When you talk about an electronic medical record, an EMR, an electronic health record provider, remember, they're only dealing with a very small portion of the population, and sometimes only once every other year. How many times do you have surgery on your knee? That's useful to know, but it might not be predictive. Whereas if you just tell me you have diabetes, I pretty much know everything I need to know about how to treat you going forward. And diabetes, as you know, from Livongo and from my own family foundation where we fund so much research, we know a lot about it. but it's always going forward what you're going to do. What is the plan for that person going forward? How do you get them to want to follow that plan to stay healthy? So that's true in most chronic conditions. So looking backward can be helpful. It can be necessary on things like you need to look at, if you're doing heart surgery, what's the history? And for that, we own the largest business in the country on expert medical opinions called 2nd.MD. So I would never, whether it's you or anybody else I know, no one should ever have somebody cut into their body without getting a second opinion. I have a friend who is going to have heart surgery. He would never go to a restaurant without getting a second opinion from Yelp or somebody. And yet he's about to get surgery, heart surgery. And I say to him, have you gotten a second opinion? No, this is what the doctor thinks. You don't want anybody to just give a second opinion. And so I think that you can approach it from a number of areas. I hope we all collaborate, make it better. We want to integrate with all the electronic health records and bring all that in. We want to integrate with all of the different information, and all our information is open, and we will build a link to anybody who's interested in making healthcare better. So, but the actual tools you need to do it are, first and foremost, you have to engage with people. And how do we do that? Well, look at every platform we have out there that people use every day. It's easy to use. It's about the customer. It's not about the business. Did you think 20 years ago, if you tried to book your own ticket, people would say, oh, it's way too complex. And now, of course, we all do it. 20 years ago, if I said, I'm going to have a limousine in front of your place in 5 minutes, you'd say, oh my gosh, he must be wealthier and, in that business. And now today you say, he knows how to use Lyft or Uber. So technology should be used to make these processes easier and to take costs out. And that's the one other challenge. There's a lot of people in this business making money from doing the wrong thing. And we get the ability to start from scratch and say, we shouldn't make money doing the wrong thing. We shouldn't have an incentive to do more surgeries. That can't be a good business for anybody. And yet today, it's absolutely the way that people make more money doing more surgeries. And I don't even fault those people. I think there's some great doctors who say the way I help you is to do surgery. And the problem is we're sending the wrong people to those doctors without a second opinion, without trying other therapies. And consequently, we're seeing the cost and the complications that could have been avoided. So I think that, I won't comment on others other than to say that I think Transcarent brings together this uniqueness in using AI. Remember what AI does. If you ask a question and you're using one of the engines and you have history turned on, it'll say, I checked 27 different sources instantly. And think about healthcare. I got to pull together all those different sources, but missing just one of them. If I didn't know you're on a certain medication, that could be the difference. And so the ability to rapidly pull together all that information and then reach conclusions and provide those conclusions to smart people, physicians, nurses, caregivers, therapists, and just support people. And to you as an individual, super important. And I think that's going to be the differentiator. I mean, even today, to the current LLMs, they're asked, I think it's 100 million questions a day on healthcare. Why aren't they being asked to their doctors? Why aren't they being asked to health systems? Because they don't have an easy to use way to access that incredible information. We want to help deliver that easy to use way to stay healthy.
One of the questions, we work a lot with scaled specialty players, so some of the largest ortho MSK players in the country, cardiology, value-based care oncology, multi-specialty. And we get this question a lot on they have interest and intrigue working directly with employers, but not exactly sure what that means and how to do it. Should they be reaching out to Transcarents? Because from their perspective, they offer the highest quality, lowest cost, full stack of solutions within those given specialties. So maybe they don't cover inpatient, maybe they don't cover all the specialties that a hospital covers, but they do offer perhaps more comprehensive care, more preventative care than a hospital would offer in what they do cover. And yet they feel sometimes siloed out of the discussion because they're not a hospital. So what advice do you have
Yeah, they
And
should.
and do they make for great partners for Transcarent?
They're great partners. We have a number of them as partners today. We'd love more because we're an open network. And you're exactly right. In many cases, rather than going to a big hospital to have your knee surgery, you're better off in an ambulatory surgery center that only does knees. And, there's no secondary or very limited secondary infection risk. In many cases, because they do so many, they're not only higher quality, they're more efficient and their costs may be lower. So everybody wins. That's the kind of thing we have to do in healthcare. But that's why you need all of these partners to be brought together by somebody who doesn't have a vested interest. I'm not making money or more money if they go one place or another. I have no interest in any of that. I want to connect the right partners.
I think it's a great point, with the not having a vested interest. Really, the vested interest is focusing on experience and
Yeah. And in
allowing that to
fact, the
take a seat.
vested interest is the lower cost, not a higher cost. And so that's why even in our surgery business, we've capped costs and we're driving the cost down as opposed to in bundling surgeries to make it easier and more cost effective, as opposed to trying to benefit from having more surgeries done or, having higher costs. That should never, you always have to look at how this is happening to make sure you're getting the right advice.
Glenn, I could go on for a while here. This is super interesting, and I really appreciate the time. I want to be respectful of your time. So thank you so much for taking time out of your day to share about Transcarent and all that you have done in the healthcare market. Really appreciate it. Very
Well,
interesting conversation.
thank you. Thanks for giving us an opportunity to talk more about the business, about the future of healthcare. And thanks for all the good work that you're doing to help move people along and move them forward to better solutions. Great to talk to you today.
Thank you.
Thank you for joining us on Analyzing Healthcare. Stay informed and stay inspired. Don't forget to subscribe and visit scale-community.com to become a Scale Community member. Until next time, keep exploring the ideas that shape our healthcare systems.